Hi, I'm Steve Nelson, Associate Executive Director of the American Association for Respiratory Care. We've been asked by Forrest to help out on the Spirometer Quality Assurance Program for the LAS MD45 project. Calibration checks need to be performed every day before you do any testing. Here's the procedure to do that. Select Calibration, check Calibration, and the calibration check. Enter your technician ID. Once this message appears, you're ready to do the calibration check. Be sure that you use the full travel of the syringe as you're doing this. Try to avoid banging the syringe and going too rapidly during the calibration check. You need to make sure that the expiration and inspiration variability are less than 3.5%. As long as these two numbers are less than 3.5%, you're done for the calibration for the day. You're now ready to perform a test. Select the Perform Test and select a new patient if this is a first visit, or select Recall if it's a repeat visit. The ID should be entered as your 3 or 4-digit site number plus the subject ID with preceding zeros. So for example, our site is 9999 and the patient number is number 1. So we would enter 9 by pressing the 9 multiple times. Wait for the cursor to appear, press it again for the next digit. Wait again. For 0, press the 0 twice. And then number 1. Don't put any information in the name. Press their age, height in feet and inches. It's not necessary to enter the weight. Ethnicity should be whatever group the patient identifies himself with, although the only correction factor is for African American, and that's a 12% correction factor. Once you see the message saying that you're setting the baseline, you're ready to put the spirette in. Select a spirette, pop it out of the protective wrap, grasping the mouthpiece end of it, and then turn it so that the arrow is up. Now you'll need to line the arrow on the spirometer up with the arrow on the spirette and insert it until it's seated firmly at the bottom. Leave the plastic cover in place to make sure that you're blocking any airflow. Once the spirette has been inserted correctly, make sure that you leave the cover on top of it and set the baseline flow. You'll be instructed to block the spirette, that's what the cover is for, and then press Enter to continue. Once it's set the baseline flow, you're ready to do the test. Well, hi Bobby.
Hi.
How are you today?
I'm fine.
Have you had a breathing test before?
No.
We're going to do one today and see how much air you can blow out and how quickly you can blow it out. I'm going to show you what I want you to do first. I want you taking as deep a breath as you possibly can. Fill your lungs all the way up. Put this mouthpiece between your teeth like this. Pucker up tightly, then blast your air out as quickly as you can, just like this. You keep blowing out until your lungs are empty, okay?
Okay.
I'll give you this thing here and we'll get started. Okay, now taking as deep a breath as you can, all the way in, fill your lungs up and blast out as hard as you can. Keep blowing, keep blowing, keep blowing, blow, keep pushing, keep blowing out, keep pushing, keep pushing, keep pushing. Good. Thank you, that was excellent. Following the first effort, you'll notice that you always get a session quality grade of D. That's because you only have one test. Even though the test is good, you still don't have 2 acceptable efforts. So you need to do additional tests until you get a session quality grade of A, B, or C. We'll continue with the testing and show you how that works. We're going to do that once more. Make sure we get your best effort. So same thing. Okay, now taking as deep a breath as you can, all the way in, fill your lungs up and blast out as hard as you can. Keep blowing, keep blowing, keep blowing, blow, keep pushing, keep blowing out, keep pushing, keep pushing, keep pushing. Good. Once you have at least 3 acceptable efforts, make sure that you have 2 that match before you can be done with the session. In this case, the FEV1, the 2 best values match within 0.03 liters. That's less than 0.15, which means FEV1 matches. You also need to make sure that the FVC matches within 0.15 liters. This is 0.02. Both of these numbers, FVC variability and FEV1 variability, need to be less than 0.15. You can see what your session quality is in this upper corner here where it says A. A, B, and C are acceptable session quality grades. At this point, you're ready to print. You can either print to a printer or save this on your PC by connecting the USB cable. The AARC has an office spirometry certificate program that we're going to be using during this study. The idea is to make sure that everybody has at least a basic competency in order to do spirometry testing. The certificate program consists of a written online exam with 40 questions. Following the successful completion of that, you'll be required to send in 4 different patient sessions. The patient sessions don't have to be actual patients, but can be volunteers or coworkers, anybody that you can find to do the test for you and make sure that you get good results. If you have any further questions about the program or have questions specifically about a particular patient session, feel free to email us at lasmd45@aarc.org. We'll get back to you as quickly as we can on the email, or if you want, you can call us at 972-243-2272. I'd like to thank you for your time in watching this video and hope that through our efforts, we'll be able to get good results for this clinical trial.